Recording is on.
Hello everyone, and welcome to today's webinar on MEG's Patient Experience module. Over the next little while, we'll explore how this powerful tool helps healthcare teams gather targeted patient feedback and transform it into real, actionable insights that improve care. We are thrilled to have David with us, who will be walking through the features and benefits and details. This session is being recorded, so don't worry if you need to revisit anything later. The recording will be shared with you. We encourage you to type any questions into the chat as we go along, and we'll be answering them at the very end. With that being said, let's dive right in and hear from David.
Thanks, Mahmoud. Just let me share my screen. So hello everyone, and welcome to the first day of MEG Digital, our new product-led webinar, which we hope to grow year on year. For those of you who don't know who I am, I'm David Scully, Head of Product here at MEG, and I've been with the company approximately 7 years, and I spend my time ensuring every feature delivers real value to our users. Today I'm going to walk you through one of our latest modules, the patient feedback module. This module is designed to make it simple for your team to gather, review, and act on feedback from patients in a structured way. So there are multiple ways to share a survey with patients. You can import a list of discharged patients, so each person automatically receives a link. You can also share the form directly through a URL or by displaying a QR code, making it quick and easy for patients to access the survey on demand. Every survey can be set up as anonymous, or if your organization prefers, you can allow identified responses. Anonymous feedback often encourages more openness, but when responses are linked, you have the option to follow up directly. MEG gives you the flexibility depending on the situation. If you choose to capture identified feedback, you can open one-to-one communication with a patient to clarify a point or even just to acknowledge their feedback and thank them. In some cases, patients are happy to provide their contact details, such as an email address, and when they do, MEG enables a secure one-to-one communication directly from within. This is useful if you need to clarify a point, and all of these conversations are logged and stored alongside the original survey response, so nothing is lost and everything remains part of the record. Importantly, feedback doesn't just sit in the system. You can create and assign tasks directly from a patient's comment, whether that's a facilities request, a clinical observation, or an improvement suggestion. So feedback naturally flows into action. Alongside actions and tasks, we provide detailed reporting and dashboards. These give you a clear picture of response rates, patient sentiment, and recurring themes over time. You can track trends across wards, services, or specialties, and export reports for governance meetings or board packs. So, in short, the data isn't just collected, it's organized and visualized to support real decision making. One of the most powerful aspects of this module is capturing the patient voice. Alongside survey ratings, patients can provide free text written feedback in their own words. So MEG automatically runs sentiment analysis on these comments, highlighting whether the tone is positive, neutral, or negative. If a piece of feedback is flagged as concerning, alerts can be triggered instantly to the relevant people, making sure nothing important is missed. The comments are also auto-categorized, so over time you can build a clear picture of themes emerging across your organization. And to see sentiment analysis and auto-categorization in a deeper action, join Manassi in tomorrow's 2 p.m. session dedicated to AI usage in MEG. So that gives you an overview of the patient feedback module and how surveys can be shared, how responses can be anonymous or identified, how tasks and communication flow from feedback, and how dashboards bring it all together. Now, rather than just talking through it, let's switch into MEG and see it in action. I'll start by showing you how a survey is set up and shared, and then from there we'll look at how feedback comes back into the review screen, how tasks can be created, and finally how everything appears in a reporting dashboard. This way you get a feel for how the module works on a daily basis. Second. So now that we're logged into MEG, first of all, I'm going to show you how you can import a list of discharged patients, which will automatically trigger an email or an SMS to the relevant numbers and email addresses from your patient system. I navigate to import data, click choose file, and I'm going to import a list of discharges from the previous day. As you can see, I've successfully imported 2 new patients into the discharge list. This process would have automatically triggered an email to both patients or an SMS if they had a number attached. Over here in my inbox, you'll notice I've received an email requesting feedback on my experience with MEG. Within the email, there will be a link to a survey. Alternatively, this link could have been sent manually via an email from one of your employees or used as the landing page for a QR code which can be placed anywhere in the organization. When I click the link in the email or scan the QR code, I'm brought to a survey. This particular survey has 5 questions. 4 are mandatory, highlighted in red, and 1 is optional, titled Your Voice. My colleague Manassi will expand more on the AI functionality behind Your Voice in tomorrow's webinar, but for now just be aware that this section can run sentiment analysis and auto-categorization based on what the patient types in. For today, I'll concentrate on some other features of the patient experience. Let me go ahead and submit a survey. Before I do, I just want to show that if I open this in an incognito browser, I still have access to the form, and this is how patients can send in their feedback unauthenticated via our web forms offering. So navigating back to the dashboard now, as you know, one of the key metrics driven by patient feedback is the Net Promoter Score, or NPS. We can see it updating in real time. When I refreshed the screen, my recent feedback as a promoter increased the NPS score. The NPS score is derived from the percentage of promoters minus the percentage of detractors to the would you recommend question. Another key aspect of patient feedback is creating actions and closing the loop when a negative piece of feedback is provided. Let me show you how this works in MEG. So looking at the patient feedback in the patient voice section, I'll focus on a negative piece of feedback. We can see here from the suggested sentiment that the feedback is negative from this piece of text. And when I read through it, I can see that the patient noted that the lights were left on at night, preventing them from sleeping properly. From within this view, I can send the report to a colleague, or I can open the entry myself. Once I open the full entry, you'll notice on the right-hand side the actions area. I'll go ahead and create an action and assign a task to my colleague to review the nighttime lights policy. Just grab a piece of text I have copied. We can assign this to a colleague and give a due date if required. I'm going to categorize it as a policy change. And once I hit save, this person will receive an alert as long as I tick the send email option. This can be turned on by default, so you don't have to tick it every time. And just to mention, if you join my colleagues later in the week for the complaints and incident webinar, you'll see how 3 different roles interact with each other during a workflow in MEG, and that will bring in task handlers to these type of actions. So I touched on earlier anonymous versus tracked feedback, and I want to show you how the review screen looks for anonymous versus tracked feedback. At the moment, we're dealing with an anonymous report, and if I just switch to another tab, you can see directly communicating with the patient from within MEG is now possible. Because this patient has provided their email address, we can communicate directly from MEG. This differs slightly from a standard email because colleagues can see the communication I've sent as well as the patient's replies. And this just creates some shared awareness for current colleagues and all future employees that will ever need to read this report. So I can go ahead and thank the patient for their feedback. You see that's pending for maybe 10 or 15 seconds, but eventually back over here, I have received an email from within MEG, and replies will of course come back into this section within MEG also. So I just want to take another moment to show you a dashboard of a survey with some additional questions. We've been dealing with a survey with only 4 questions up until this point. In this survey, we have many more questions, and they're divided into different categories. So as you can see the scores broken down by category, and they dive into the areas that truly need improvement. You see metadata can be tracked in the background for the different fields you may want to track. And just going back to our original form for one moment, I want to show you the task stats section. So these are the different categories of tasks we're creating for colleagues. We can track them by closed, in progress, and open, and also get an overview if we click into the QAP tab of how that's looking and all the due dates. So I'm going to jump back into PowerPoint now just to recap what we've seen today. So you've seen how easy it is to import patient data in bulk, saving time and removing manual entry. We looked at how events in MEG can automatically trigger emails or SMS to the patients so we can receive their feedback via a survey. You can share anonymous survey links or allow identified responses. We explored how sentiment analysis and auto-categorization can help. We also showed how we can capture the Net Promoter Score, giving you a clear measure of overall patient satisfaction. From there, we saw how you can escalate tasks or actions to a colleague, ensuring every piece of feedback leads to an improvement. And when a patient provides their contact details, you can even communicate directly with them from within MEG. Finally, it all comes together in the dashboard view, where you can drill into results, track trends, and see the tangible impact of patient feedback across your organization. Together, these tools make it easier than ever to listen, learn, and act on what patients are telling us. Thank you for joining me on this introduction to patient feedback in MEG. I encourage you to join us for the rest of the week as we showcase how AI is being incorporated, explore how MEG supports handling JCI standards, and demonstrate how workflows can come together across multiple modules. I'll be going to all the sessions to engage with the Q&A portion of the webinar, but for now I'll hand back to Mahmood to check in with how the Q&A is looking for today.
Thank you, David. And thank you all for joining us today and for your participation. We hope you have gained valuable insights into how MEG's patient experience module can help your teams not only capture patient feedback, but also turn it into meaningful actions that improve care. If you still have questions or want to explore any point further, please send them to the chat. And remember, the recording will be shared soon for your reference. Well, if there is no more questions, there's one from Justina. So Justina's asking, can we create our own patient questionnaire?
Hi, Justina. Yes, absolutely. So the survey and questionnaire you saw today was just an example, but we would work with your team to get the exact questions you need. So yes, you can create your own questionnaire. Thank you, Sophie.
Thank you, Sophie. Well, if there's no more questions, we wish you a great day ahead and looking forward to seeing you in our upcoming mix sessions. Take care and have a good day.
Thanks, everybody. Thanks, Mahmoud.
Thank you.